Hey, good afternoon, everyone. Thanks for joining us in this first in a new series of bite-sized lunchtime sessions covering innovation and entrepreneurship in NHS Scotland. I'm Gillian Henderson and I head up the project management team at InnoScot Health. I'm joined today with my colleague, Frances Ramsay, our innovation manager for the West of Scotland. So we're planning to run these sessions monthly around the last Tuesday of the month. Sessions are going to be recorded. We're actually recording just now, and they'll be available afterwards on the InnoScot website. So we've got a programme of topics we're looking to cover over the next few months, but we would encourage you to get involved. If there's areas that you would like to see us focus on, please let us know. Jane's monitoring the chat box today, and we should have plenty of time for questions and answers and hopefully some good discussion. So today we're going to give a brief overview of InnoScot Health and the services we offer before looking at the innovation landscape. We're also pleased to be joined today by Professor David Lowe, Clinical Director for Health Innovation at the Scottish Health and Industry Partnership. He's also an emergency consultant at Glasgow's Queen Elizabeth University Hospital and West of Scotland Test Bed Lead. And he's going to give us some insight into Scotland's innovation test beds and how they're accelerating adoption of fresh ideas, progress that they've made to date and the criteria for getting involved. So Scottish Health Innovations was formed in 2002 to identify, protect and commercialise intellectual property coming from the NHS. Over the last 20 years, the scope of our role has increased, but the core remit remains the same: to encourage a culture of innovation, accelerate the development of healthcare innovations and commercialise those ideas. As part of our anniversary celebrations, we rebranded to InnoScot Health, and I've got a new image, branding and website too, so do head over there and take a look. We're funded by the Chief Scientist Office and are a not-for-profit organisation. We receive around 100 ideas a year from the NHS, and following assessment, we take around 10% of these forward to our pipeline process, which Frances is going to describe more fully. As part of our work in encouraging and supporting innovative ideas from within the NHS, we've recently surveyed the healthcare workforce right across Scotland on their attitudes, experience and knowledge of innovation. So positively, 90% of healthcare staff believe innovation is important to improve NHS Scotland's service. And important findings have emerged as part of that survey in regards to their ability to contribute to improvements across health and social care services. 64% of staff already consider themselves to be innovators, and 76% of healthcare staff have ideas to improve healthcare and healthcare delivery. So motivations to propose these new ideas are generally centred around making working lives easier, making a difference to patients and driving efficiencies, which is positive. But what's also emerged is that there's various factors which could improve how these new ideas are identified, developed and implemented, and also the routes to progress an innovative idea. There was also some issues around who to approach with a new idea and accessing that support, which is really what's driven this series of webinars and the support that we would like to provide. So I'll hand you over to Frances now for an overview of the InnoScot process and the services that we offer.
So hi everyone, thanks for joining. Just going to talk through a few slides here. So we've got a really robust process that allows us to identify innovations that have the best potential and where our expertise is best placed to bring ideas to life really, and ultimately improve the patient experience. It's important to mention just now that we do have a team of innovation managers throughout Scotland. So there's Liam Eyre, who covers the north, Fiona Schaefer, who's in the east, and myself, who covers the west. And Robert Ray has overall responsibility for our team. We assess the needs presented, really, the who, the where and the why, and we look at all the NHS resources, the market size, some technical feasibilities, whether the idea is novel and the inventiveness of it. And more importantly as well, we cover intellectual property, and it's really important that your idea can be protected to go forward. So the next slides will cover what the innovation pathway is all about. So as I said before, we try to protect and we support all the Scottish Health Boards in an innovation when it can start with just an idea, and we'll potentially select this and then progress it forward with the team. We collaborate with academia and other industry partners to try and support this innovation process. We have and conform to the ISO 13485, which is a quality management system, and it's harmonised with the Medical Device Directive. And we also ensure that legal responsibilities are covered, awareness is covered, and compliance, so that the products that we do help to develop are under an accredited regulatory framework. We also get involved with funding and work with other agencies such as the Scottish Entrepreneurs, Scottish Enterprise, Innovate UK, and we can help the innovators actually apply for funding at a national level. And our project team manage and they help to develop the ideas, and they're really key to liaising and ensuring that everyone's on the same page, and provide really good communication throughout the process. Some of their job involves prototyping, validating some data, and providing important evidence bases, and just to prove the concept of the idea, and ultimately as well to create an investment, a return on the investment. And really our end goal is always commercialisation. We're looking to generate revenue for both the innovator and the health board that they work for. And it's ultimately, this will help NHS Scotland to reinvest into future innovations. And we're really at the end of it all is the patient, and we want to try and improve the patient care, and even more importantly now in the current climate, improve the workflow of patients going throughout the NHS. So that all being said, if you do have an idea, we're very keen to hear from you. It usually comes into our website. So as you can see at the bottom there, we're www.innoscot.com. And then one of either myself or some of my colleagues will get back to you and discuss it and see if we can take it forward. So I'll hand back over to Gillian. Sorry, that was a big whistle-stop tour, and she can carry on with the rest of the landscape.
Yep. So one of the words that's often used to describe Scotland's innovation landscape is cluttered. And looking at this slide, it's not difficult to see why. I'm fairly confident that I will have missed some key people off this slide, and for that, I apologise. But even at first glance, it's busy. It looks impossible to negotiate. If you are an innovator or an entrepreneur, where do you actually begin? But I think it's important to note that there's a wealth of support out there, possibly less of a landscape and more of a web. I heard it described the other day as a climbing frame, and I think that kind of sums up the journey that might be ahead of you. But it spans specialties. There's different expertise in very specific areas, and I think what we do have is lots of connected and collaborative organisations who bring together industry, academia and the healthcare sector to help enable innovation, testing and evaluation and adoption at scale of these new health technologies. Also, I think it's important to note that there's a lot of willing to move these innovations forward, and often the sheer volume of support can make things at times frustrating to negotiate. You may not land with the right agency first time, but as well as offering support, it's a network too. And so where a project might not necessarily fit with one agency, they'll be glad to pass you on to somewhere where it might fit better elsewhere. So ultimately, it's important to reach out to someone, anyone. If you're at the very beginning of your entrepreneurship journey, it's worth considering the NHS Clinical Entrepreneur Programme. This is a workforce development programme that runs out of Anglia Ruskin University, but has recently started welcoming Scottish applicants. So this is second year of there being a Scottish cohort. We've also got the Innovation Fellowships run by the SHIP team, which is targeted at early stage innovators. If you're an NHS employee, it's worth approaching your health board RD&I office and regional test beds. They can obviously help with an idea assessment and pass you on to InnoScot Health. But we've also got bespoke innovation centres which connect industry to academic expertise in order to develop solutions to healthcare challenges. We've got Scotland Innovates. They provide a portal for external companies and citizens to engage with NHS Scotland as early as possible. They have a portal for submission where they're triaged, assessed and then implemented. Should also mention the SHTG group. They provide really useful advice on the type of evidence you'll need to generate to demonstrate effectiveness and safety, taking into account health economics and patient and clinical views. MDMC over at Heriot-Watt, they can provide SMEs with advice on manufacturing, business development, regulatory issues and funding sources. They've got really good on-site facilities. They provide access to equipment for pilot manufacturing. We've also got Scottish Enterprise. They have their Health for Wealth programme, which supports the NHS with access to academia and industry. And they also have their High Growth Spin Out programme, which is a really good funding scheme. CivTech is a Scottish Government funded initiative. They launch calls framed as challenges to develop solutions. Now, some of these challenges are quite specific and immediate. Others are much more open, so more of an invitation to reinvent a process or service. And we've also got the ANIA pathway, which is, I suppose it's still a relatively new pathway, which is aiming to fast track adoption of new innovations. So I would say this is really mainly for high impact transformational innovations which are aligned with Scottish Government priorities, but what it does allow is for the coordinated adoption across all the geographical health boards. So lots of support available there, and probably more than we could hope to cover in just one session. But I hope that what it does show is that there is a lot of support out there, and really the first step in getting access to it is just to reach out. So I'm now going to hand over to our guest speaker for today, David Lowe, for a deeper dive on the West of Scotland test beds.
Good, so hopefully everybody can see my slides, and is that, Gillian, can you see them okay?
Yes, I can.
Perfect, good. Okay, so thank you very much for the opportunity to speak today. So I've got the advantage of just hearing Gillian speak, so I have kind of rejigged my slides a little bit, probably to respond and perhaps provide a little bit of support. I think for clarity today, I'm going to speak as Clinical Director for Health Innovation within the Scottish Government, though would note that obviously there's a locus of my expertise is within the West of Scotland Innovation team as one of their clinical leads. So that pipeline slide that Gillian showed was really helpful. And in my head, because I have had to navigate this both as an academic, as an innovator, as well as somebody supporting the kind of wider structural requirements, has been able to lay out each of those partners within that space, recognising we move from ideation, as Gillian says, through to potentially adoption and implementation within NHS Scotland. What I'm going to describe in terms of the test beds is that triple helix collaboration between industry and academia to develop ideas, to develop evidence to support their scale-up, adoption and spread. There are a number of delivery partners that support this, both for those large-scale transformational changes that ANIA offers, which is Accelerated National Innovation Adoption Service or Collaboration. And that broadly is HIS, so Health Improvement Scotland, and there's a lot of acronyms unfortunately in this landscape, which probably makes it even more complex, which provide evidence review, synthesis and analysis. Public Health Scotland around about data provision and ultimately some of the deployment of services. NES, which has both a education role, workforce, as well as increasingly within the digital service. And I know that Kevin Kelman's on here, and I presume he'll be asked to speak shortly and within these webinars. And then National Services Scotland to support both procurement, but equally looking at service readiness, which is really critical to support the 14 territorial boards, or indeed some of the special boards such as the Golden Jubilee or Scottish Ambulance Service adopting innovation. And as Gillian said, InnoScot have a role to play around about that's really important about engaging NHS workforce around about their ideas, be it devices or services, and be able to support them developing that forward. So Scottish Health Industry Partners is co-hosted by the Chief Scientist Office and the Chief Medical Office, as well as the economy side. And that's really important because while we are delivering services and solutions into the NHS, we're actively seeking to grow the economy, and that's really critical given the current fiscal status, but equally to be able to allow Scotland to play a greater part, because actually we have huge strength in the life science sector. It's how do we maximise that, recognising the NHS as a partner. So SHIP has a number of key actions, demonstrating the priorities for innovation and be able to describe those, working with the life science industry groups, ABPI and others. Infrastructure investment around about the test beds to enable those ideas to be developed, to create evidence to support their adoption. Investment in funding through catalyst programs and fellowships that Gillian's already outlined, but also looking at the wider orchestration of that with other funding agencies such as CivTech and Scottish Enterprise, and then supporting adoption of innovation into the NHS. And what's the strategy to be able to do that? Because as we've said, it's complex, so therefore how do we define that approach, that pipeline to be able to do that? And then finally, artificial intelligence, both as an academic, my interest is in artificial intelligence and clinical decision support, this is clearly one of the new ways of technology, innovation and services that really Scotland has an opportunity to get ahead of. So within UK government, it's really important that we're able to highlight the life science sector as a key focus area, and that's about building on our actually world-class science and research capability, demonstrating that the NHS can be involved as a collaborator, not as a passive customer of these technologies, devices or solutions that are created, but also how do we create that business environment? How do we support innovators, entrepreneurs, developing their products, but be able to access markets beyond Scotland, the UK, but actually accessing worldwide markets to be able to grow their businesses, to be able to do that. And there's very much a disclaimer here that I both am a director of a company, but also have been involved in the development of innovations, either co-design or co-development phase with either big multinationals, but equally SMEs within Scotland. But the locus again of my expertise is predominantly around about emergency medicine and AI clinical decision support. So unashamedly, the examples I'm going to use are around about this area. I think we all know that the NHS healthcare systems worldwide are really challenged around about demand, and that's really unfettered demand. And really the opportunities around innovation are about how do we adopt technologies to be able to support delivery of healthcare, recognising we've got a rising tide of increasingly frail, comorbid patients that need to be cared for, potentially in the acute sector, but increasingly how do we push that care into the community and promote self-management. Within any innovator that's been working in this sphere, they understand that the NHS essentially is a relatively old organisation that we're trying to put new technology into, and that often equals a very expensive old organisation, and there's quite a considerable amount of effort going in around about transformation of digital services. And the digital strategy was just published last week, which really describes how we are going to manifestly move towards adopting new technologies while not actually creating a very expensive old organisation with multiple layers of integrations. And we do have a number of burning platforms around about capability and need. That's obviously the rising comorbid population, but it's equally about how we provision services to patients and citizens to be able to do that. When you ask most clinicians, they want to be able to know how the patients that they manage are doing in the community, prioritise those in greatest need, and that may be a driver around about cost, unscheduled care admissions, or indeed deterioration, and how do we surface that both to the patient to promote and self-management, but equally to the clinician to be able to think about new paradigms of care to be able to be delivered. So we have a number of lenses recognising that all the platforms are burning at present. The first within SHIP and strategy-wise is around focusing on digital health, artificial intelligence, and unsurprisingly given Dame Anna is our chief scientist, precision medicine. Moving forward into Gregor and the Chief Medical Officer priorities, that's around demonstrating sustainability, responding to workforce needs and inequalities within the health and care social provision. And then finally, demand signalling. The priorities that we think we can respond to, we're really looking for innovators, SMEs, academia, industry to respond to around the elective waiting lists, optimisation of long-term conditions such as heart failure, COPD, as well as diagnostics around about long-term conditions in cancer. And we truly believe there's an opportunity within Scotland to be able to do this. We're about the right size to do this. We actually have fairly consistent cornerstone systems for delivery, be it Track, Portal, or PACS, that allows us to be able to both get data in and be able to provide that securely to partners to be able to develop solutions in that space. CAI is clearly a huge advantage, and it allows Scotland, Scottish Enterprise, SDI, to place themselves as a place where you can grow your life science company, provide both clinical and market validation of that solution to again access other markets. So the test beds are around about that triple helix collaboration process to be able to develop products and services, recognising there will need to be a shift in paradigms of care to do that. How do we evidence that to support decision makers being able to say the current traditional model of care has been X, but there's sufficient evidence both in terms of clinical and cost effectiveness as well as acceptability and safety to be able to let's move on to a new approach to delivery of care. And these test beds are regionally based, the northeast and west, and they are around about building those collaborations to be able to take ideas from feasibility through to pilot, tested change and adoption, while concurrently evaluating them to support decision making around about scale up. And sometimes that's about investment. Others to go to Scottish Enterprise, UKRI, equity firms, VC to support investment because they want to see evidence of success about being the technical ability of and performance of the product, but equally its ability to change care because that's where the decision making comes in. There's a number of supporting opportunities, both in terms of fellowships that Gillian's mentioned, but also CATA's programme of really seed funding to develop collaborations to be able to go after larger pots of money, either from the Office of Life Science, UKRI, or indeed private finance. And again, I suppose trying to bring clarity to the innovation pipeline. The test beds are around about engaging and scoping with academic and industry partners, initiating co-design, often with the innovation centres to be able to support that. And we do a lot of great work with the Digital Health Institute to be able to do that phase, and then move into pilot and feasibility. How do we create data, be that feedback from patients and staff around about a device for monitoring vital signs or AI deployments in radiology, and then move into clinical validation, supporting regulatory approvals, as well as demonstrating, again, clinical and cost effectiveness, and be able to produce health technology assessments that can go into NICE that, again, support those companies, be able to demonstrate the value of their products and be able to build that through. I think it's really important to recognise that the test beds offer that clinical and technical validation phase, and we look to others, be it Scottish Enterprise, to support the entrepreneurial and business advice, as well as service readiness, and be able to get support from NSS and others to be able to describe how the service can potentially adopt those technologies. Because ultimately this is a collider function, that if you look at any successful business, it's not just one person that holds all those capabilities. It's an understanding you do need a chief medical officer, a chief executive officer, and often a chief technology officer, and bringing those together, recognising that both you have business, service and clinical readiness of those products that are going to come into the NHS. So the test beds provide that partner to be able to transform that idea into products and services, to enable collaborations and to provide leadership, sometimes around about strategy, around what the key infrastructure requirements are to develop, but also to support through clinical engagement, technical engagement. And our colleagues are really critical to this, to be able to refine those solutions, to integrate into clinical workflow, as well as the kind of wider workflows that happen with the patient. And that's really important journey to be able to describe. It's not just clinical workflow and data flow, but also the patient flow through that. And there's some really great work through Digital Health and Care within Scottish Government with that digital front door for patients and citizens so they can access services. And it's how do we facilitate access and be able to be really clear about what the technical architecture looks like in the future, so the target operating model for those solutions can be built as streamlined as possible, and recognising obviously there's obviously some disruption and change in that as we respond to new needs and requirements. And that infrastructure broadly, each of the test beds looks like this. So it's around about infrastructure and capability. which is access to data, clinical trials units, pharmacy, blood samples, medical device units, imaging, as well as expertise. And that's really what we're investing in, is people, capacity and capability to engage around about developing your solution, to be able to evidence it, but also support its deployment into the NHS to provide that market validation. It's really important to move on to the next stage. And one of the key enablers for that, increasingly within the space, and I know there's been a number of medtech publications that have come out in the last week, is around about how do you transact data? How do you use multiple different apps, ideally seamlessly, so the citizen only sees one front door, as previously described, but ultimately you want to be able to collect patient-reported outcomes. So broadly, how are you feeling in a structured way? Wearable data such as sensors, and these may be ambient, placed in the home, or indeed something like an Apple Watch, Things device, Fitbit, and be able to put that into a national data store with compute to allow us to be able to stratify, simple rule-based stratification often, but equally AI insights around about who in our population is at greatest risk and how can we care for them using different solutions and services. I think it's really critical, as Gillian's already mentioned, it's about recognising there's a golden thread of innovation into the NHS and be able to demonstrate its value and about us co-designing a solution that meets our requirements. But success also looks like access to external markets, because any company that predicates their sales purely on sell to NHS Scotland is probably not going to be viable in the long term. How do we encourage spin-outs from higher education institutes? But how do we also take in market-ready innovations and be able to drive their validation, demonstrate evidence of support? And that's where the test beds often play a really critical role, is say, here's a solution that's been an AI solution that's been developed in India, for instance, for chest X-ray. But how do you demonstrate generalizability, and how does it actually get deployed into a UK healthcare system? And that's one of the opportunities that we really do need to describe. So very briefly, 3 examples of innovations that I've, again, unashamedly been involved in, but really, I suppose, demonstrate the breadth of activity, both at individual project level, be able to bring through collaboration with Scottish-based SMEs, which are the first 2 examples, but then broadly setting out some of the other requirements as well. So Dynamic COPD is a co-management system for chronic obstructive pulmonary disease, which is progressive debilitating respiratory disease, and really is focused, and Chris Callan is my co-conspirator in this, around about how do we support patients in the community, how do we identify those at greatest risk, how do we provision them with the capability to tell us how they're feeling, structured patient-reported outcomes, wearable data, high-risk patients with hypercapnic respiratory failure on non-invasive breathing support in the community, and prevent them coming into my emergency department at 2 o'clock in the morning. Because when you ask patients what they want, it's definitely not to come into the emergency department at 2 o'clock in the morning to get the treatment they could have had 3 to 5 days before. And again, we're in the process of, and it's often very difficult, is developing evidence to demonstrate that shifting traditional paradigms of reactive care to a proactive digital service for high-risk patients is positive, cost-effective, as well as clinically effective. Trauma is a data collection tool, again, born out of the need to think about how, when we're going to move to a major trauma network across Scotland, how do we collect granular data to support clinical care, often in a relatively chaotic environment of the emergency department, but then how does that solution get deployed across the major trauma centres, allow data to be collected to provide insight both for quality improvement, understanding of cost, clinical effectiveness, but critically, how does it integrate into clinical care pathways? And again, Scottish-based SME opposite Code Clan in Edinburgh developed this solution, and now building out pre-hospital apps, and we're involved in the inception of the vaccination recording tool and some of the work we did through COVID. So again, demonstrating the benefits to wider Scotland infrastructure and delivery of care to do that. HALIS is a drones piece of work, again, funded by UK government, recognising that drones will be a technology that will be adopted. NHS will, for a number of different reasons, if nothing else, responding to rurality and be able to provide equitable care is a really important intervention. And again, test beds, clinical leads, supporting the development of real-life use cases of demonstrating how drones can support delivery of healthcare, often in a remote rural environment, recognising that as technology improves, as costs improve, that potentially that'll be a much more distributed, disseminated model of care provision or indeed logistics. And then the final example around about opioid-induced respiratory depression. Again, Scottish Government, Scotland has a really significant problem around about drugs deaths. We're one of the highest in Europe, indeed worldwide, for this. And a Scottish-based SME developing a centre and a service model to be able to take people with respiratory depression to support first responders, caregivers, delivering naloxone, for instance, a treatment, but equally accessing Scottish Ambulance Service if the patient requires being transported to a hospital. So a device that's now being pushed and marketed throughout the world, but again, its initiation was within Scotland, and a lot of the evidence generation was supported initially through the test beds. I hope, and this has been a very quick run through, that what we're demonstrating is a requirement for porosity, and that's really around about how do we create the environment for innovators, academics, industry to work effectively together with the NHS. Given the current situation we're in, about how do we squeeze value out of that as well, I'm not pushing that analogy too far, but how do we allow that ability to happen of those individuals being able to work across a network, a climbing frame, whatever analogy you wish to use for that, effectively in as streamlined manner as possible. So I'll take you back to that visualization that I've pulled together around the innovation pipeline, and really just highlight this is about realising value and investment we're making within the test beds, the wider innovation landscape, and how that both supports delivery, that golden thread of innovation into the NHS, but equally wider economic growth is a very key and critical goal. So thank you very much. It's very much a collaborative process, and that great idea at the start is really how do we support and engage to be able to and allow that to be delivered effectively. Thank you.
Thanks so much, David. That was really interesting, and great to see those real-world examples of innovations that are going through the test beds. I think obviously we've got time for questions, and I'm sure that the presentations probably prompted a bit of a flurry. Frances, you've been monitoring what's coming through.
We've haven't had any questions in the Q&A, so if people can put their questions to us, that would be great. Are
they over in a chat box that we can't see?
They may well be.
It was going so well.
So one of the questions that's came in is, do InnoScot issue grants to support ideas, and how do we apply for funding?
So InnoScot funding is not specifically an award of grant to a project. So generally, if someone brings us an innovation, it goes into our assessment process, and at that point, when we decide to take it forward, we would build a package of support. It's not directly awarded to the innovators. We can support with external grant applications. So obviously, the funding that we can provide is probably on the smaller scale, more to develop prototypes for proof of concept. So if a project requires larger scale funding, we can help with funding applications to one of the larger grant awarding bodies. So really it's a project by project basis, but it's not a grant to the innovator.
Another one here, David, for you, and it's because your slides were so fantastic, from Neil Guthrie. Can these slides to describe test beds be used by SDI with potential inward investors to highlight the process? Obviously noting additional partners.
Yeah, so I think full credit should go to Fiona Fleming and David Walker for production of those
there
slides rather than me. And apologies for being annoying for them asking for updates to them. Yes, Neil, I think we should note that SDI are pulling together with Donna a kind of shinier version of those slides to be reused, but I think it's a really important resource.
Thank you. We've got another one coming in saying, we are an SME. Do you have to be with the NHS to access InnoScot Health support?
So Technically, our main remit is to work with NHS innovators. There generally needs to be an NHS innovator involved in the project to access InnoScot funding and support. We do have a number of projects running that involve an NHS innovator, perhaps an academic and an SME. So it doesn't preclude you from contacting us, but there is likely other organisations. If you're just an SME, there's probably other agencies on that pipeline who would be better positioned to support you. But we're generally quite happy in the team to have a chat and signpost you to them.
I'm just having another look here. So if anyone's got any questions, if you can pop them in the Q&A. Some complicated ones for Mr. Lowe. Anyone? Sorry, David.
David, where do we start if applying for a pilot in the test beds? Is there a website where people can access?
Yeah, so there's a website for each of the test beds with an engagement form which broadly look the same, which is really around about being able to describe the problem and what the requirements are. Is it a co-design ideation issue, or is it much more around about evaluation requirements for a relatively mature technology that's higher up the technical readiness scale? So those are obviously place-based, so depending on which NHS board you work in, it's getting in contact with them to be able to do that. And again, I suppose if you are an NHS worker that you think you've got an IP-able solution device, then often it's a contact with InnoScot as well, really around about whether or not they can protect IP for you.
Yeah, I think that the key message is to reach out, and if you happen to reach out to the organisation that isn't a complete fit for your concept or innovation, your ask, you will be passed probably via someone else onto the right place. We've got some questions here around the SHIP fellowship. I think that the deadline for the most recent cohort has passed, but is there plans for a 23-24 application?
Yeah, so there's essentially going to be 4 programs moving forward broadly. There's an entrepreneurship program that's currently in place at the moment that we're going to look to kind of tech scaler version of that, recognising kind of wider requirements around about tech scalers as an investment from Scottish Enterprise. The other piece is around about the innovation fellows, which is split into a kind of senior academic group and then a junior group that's really around about developing capability. And then the third group of those is, I suppose, an industry. So really trying to move this to being bi-directional, of being industry, be able to come in with an individual to actually work within the NHS to be able to develop that product as well. So certainly the first tranche of kind of the new innovation fellows at both junior and senior level will be announced for application around about July.
Okay, no. Lots of questions about slides being shared. So the webinars are recorded and they'll be on the InnoScot website, but we can also share, I think, Simon nodding. Yeah, thumbs up. We can share them directly by email with you if you're registered to attend. And great to see so many of you connecting with one another in the chat as well. I think that's really what we're hoping for. I mean, it's a big space. It's difficult to navigate, and sometimes just being in touch with others is just a great start. So, any other questions?
Can I just say that there's some comments about research and innovation kind of overlapping. So if anyone has got any concerns about that or any ideas and they want to just run it by us as a purely advice base, just get in touch and we're happy to help.
Yep, I think if I can share and go back to our slides, I've got the list of the next webinars. I don't know where that is. So our next planned session is on 29th of March, and we're going to be looking at funding for your innovation. In April, so InnoScot periodically launch our own innovation calls. So we will be launching the next call at the end of April. On the 24th of May, we're going to be looking at medical device regulation. Elaine Gemmell will be hosting that for us. And on 21st of June, we have got protecting your intellectual property. So I believe we've got our patent attorney coming along. So that's probably quite a good one to submit questions in advance for. They tend to work quite well, you know, as part like a workshop. So apart from that, thank you so much everyone for coming along. I hope you found the slides useful. Probably a lot there that will prompt discussion. So do feel free to reach out if you've got any questions that weren't covered on the chat. And thank you so much to David for supporting us today and coming along.
Thank you very much. Thank you all.
Thanks, everybody.
Thanks, everyone.
Bye. Hope to hear from you
Bye.
soon.